Hello there, my name is Dr. Andy Knox. I'm one of the partners at Ash Trees Surgery in Carnforth, and I want to talk to you in this video about how to get the best out of your consultation with a health professional, whether that's a GP or a practice nurse, a nurse practitioner, whether it's a person in hospital, a consultant, or a junior doctor, or one of the nursing team there, whether it's in a ward environment, wherever it is. I hope that your consultation with whoever you are seeing is a very positive experience. Now, one of the things I often see in my surgery is people complaining that they've had poor experiences. And so, and those things basically tend to fall into one of three areas. Either patients have felt that they were treated rudely, or with a lack of compassion, or a lack of genuine care, or with a lack of empathy, or that someone just brushed them off and didn't really listen to them. Listen, that is always unacceptable, and it's okay to challenge it. It's okay to challenge it at the time. It's okay to challenge the person with whom you're consulting, who's making you feel less than human. And it's okay to complain about it afterwards if you don't feel brave enough at the time, and to help a person reflect on their own practice so that it doesn't become something that goes on into the future and affects lots of other people too. A lack of compassion in care is not an okay thing, and it's something we need to tackle together. The second thing that people feel frustrated with, and this often comes back from a GP setting, is that people don't understand why the GP says to them, "What do you think's wrong with you?" And the patient says, "Well, that's why I'm here. I don't know what's wrong. I've come to ask you." Now, I just want to explain why doctors or nurse practitioners or other people ask those kind of questions, all right? The reality is that if you come to see me and you've got a worry on your mind about what something might be, and I don't explore it and don't try and find out what it is that you're genuinely worried about, then the likelihood is you're probably going to come back another time and another time and another time until we tell you, or you definitely discover for yourself, that it's not the thing that you've been worried about. So that can feel frustrating for you because you're not getting your questions answered, and it can feel frustrating for the doctor because they feel like they've already seen to you about this problem and talked it through. So when I see my patients, especially for someone presenting with a first-time problem, it goes something like this. I say, "Hey, how are you? Really lovely to see you today. How can I help you today?" Okay, and then usually they give me a good spiel. Now the secret is, don't try to tell your story well, okay? And your doctor or nurse or whoever should hopefully not interrupt you too much in the first minute and a half to 2 minutes. Just let you talk, let you tell your story, and they should be listening in really well, actively and attentively to what you're saying. Now, when I've heard my patient's story about what's going on, what I like to do next is say, "Okay, thanks so much for telling me all of that. I've got some more questions that I'm going to want to ask you in a minute, okay? But I'm also beginning to formulate in my head a few ideas about what this could be. But I'd love to hear from you what you thought might be going on so that I can explore with you maybe what you're most concerned about, okay? And then just give the patient, again, some more time to explore with me what they think might be going on, what they're most concerned about, and also what they're most hoping from the consultation is what we call ideas, concerns, and expectations. And every clinician that you see really should be exploring that with you. And some of us maybe do it more clumsily than others, and that can feel frustrating. But the idea behind it is to help you unpack what you've really been thinking about so that we can help you answer those questions and work out, is it that? Is it something worrying? Or is it actually something quite trivial or something that you can do something about yourself? So that's the reason for that part of the consultation. We can always improve. So if you encounter consultation skills and you thought, actually, do you know what? You could have asked that question better or differently. Write to us, let us know, because we love to improve on our skills, but maybe do it in a way rather than complaining, trying to encourage us to just think differently or say, "Hey, you asked me this way, that made me feel like this, but actually if you had asked me this way, then that might have been more appropriate." So do come back. It's okay to challenge a clinician if you feel that we're being clumsy in the way we're communicating with you, but I want to help you understand why we're asking those kind of questions at the beginning of consultations now. It's to make sure that we explore fully what were the reasons that caused you to come to see your doctor or nurse in the first place. Okay, and the second thing that is really important to say is that, or the third issue, sorry, that people come to get frustrated about is they feel like when a diagnosis is made and when treatment plans are offered, that those things can sometimes feel a bit forced on them. That, hey, this is, okay, you've got this problem, therefore you've got to go away and do this. And a lot of people can feel quite disempowered by that or think, I'm not sure I want to do that, or aren't there any other options? Now, there's a group called AQUA, who are the Alliance for Quality, and one of the things that they've done is to put together 3 very basic questions that you can always ask whichever clinician you're seeing at the end of a consultation. And I think they're 3 brilliant questions that will help you think through how to get the best and most out of your time with whoever it is you're seeing. And the questions are as follows. The first question is, what are my options? Okay, what are my options? That's a huge question because whenever you are offered a treatment, there are always options. Okay, so whatever the condition is, you could often care for it yourself, or you might need a course of physical therapy, or you might need some counselling, or you need some tablets, or you might need whatever. There's always a range of things. Sometimes it needs a referral, sometimes it doesn't. Now, sometimes the options are going to be limited. Sometimes they're going to be limited because of cost. Sometimes they're going to be limited because they just wouldn't be right for you. But that's for your clinician to talk through with you and help you understand. And then you can have a list of realistic options that are going to be right for you. Okay. The second thing is, what are the pros and cons of each option for me? All right. So not only do you need to know what your options are, if you're going to make an informed choice about what's going to be happening to your body, you need to know what are the good points and what are the bad points of each of those options. And then the third thing, how do I get support to help me make the decision that's right for me? Okay, so, you've given me my options, you've told me the pros and cons, I still need some space to go away and think about that. Where else can I get help? Now, it might be a further consultation to talk it through more, but most likely it's going to be reading some literature. It's going to be thinking stuff through maybe with another person. It might be going away and doing some looking at a website or listening to a podcast or various other bits and pieces. There are usually always leaflets or different things that you can take away to help you think about what's going to be right and best for you. Okay, so don't be treated with a lack of compassion or disrespect. It's not okay. Don't get too frustrated when your GP or your nurse practitioner or whoever is trying to find out what it is that you're concerned and worried about so they can get to the nub of the issue and make sure they tackle that for you. And thirdly, don't leave the consultation room feeling forced into a course of treatment that you're not happy with. Make sure you've understood the range of options available. If necessary, go away and think about that further before you make your choice. But make a choice that is right for you, that makes sense of your life, and understand that the health practitioner is a coach, not a dictator. We're not there to tell you what you must do. We're there to present you with options and help you make the choice that's right for you in the context of your life circumstance. So I hope you find that information helpful and try and make sure that you get the best out of your consultations.